Welcome back to 12 on Health. Now, if you have dealt with severe sinus issues, you know they can be debilitating. And today, we want to walk you through a minimally invasive procedure called Balloon Sinuplasty that a local ear, nose, and throat expert says is changing the quality of many patients' lives. Here now is Dr. Robert Weiss of the Connecticut Center for Advanced ENT Care. He's based right at the Eye Park in Norwalk. Thanks for being here.
Thank you. Thanks for having me.
So this is, who is a candidate for this for starters?
Well, lots of folks. People that have recurrent infections, chronic infections, sinus headaches, and it's for people that have had multiple treatments already, medical treatments, antibiotics, steroids, nasal sprays,
okay, so those
allergy
have not
treatments.
Worked for them
Right.
over the counter. So now you realize you want to get in there into the sinuses because why?
Sinuses need to drain in order to be healthy. So if there's mucus trapped in there, if there's bacteria trapped in there, it has to have a way out. If there's pressure building up in there, it has to be able to come out. So what the procedure does is it opens that blocked passage. In the past, you'd have to do surgery for this.
So you get the instrument right up into there.
Now that's the catheter, and there's a little light that helps us guide us into the sinus so we know where we are. And then the balloon, which is part of the catheter, gets advanced into the blocked portion of the sinus. And then once it's positioned, the assistant will inflate the balloon.
Okay.
And you can see there that the passageway has been permanently widened because these passageways are essentially made up of a very thin bone.
I'm surprised you're not, this is going to sound horrible, but like suctioning out some of what is in there.
Well, I didn't show that, but
you
yes,
do a little of that first?
You can not only suction out, you can irrigate with medicines, with saline.
Okay, so you are loosening it up somehow.
Yes.
And when you put the balloon in, does it stay?
No, this is just a device to create an opening, and you get out.
How long do you leave it there for?
Literally seconds.
Oh, it happens that quickly.
Yeah, so once it's opened, you might open it in a few places. You take the balloon out, and depending on how many sinuses you're opening, you move on. So this is something that not only can be done in the operating room, but a lot of it can be done in the office setting under local, which is really the big advantage. Yeah.
Obviously, if you can stay out of the hospital and just get it done right there in your office. Now,
Right.
this is the upper sinus cavity.
Right.
Similar situation?
Yeah, so what they're showing you there is the light going into the sinus. The green depicts that there's an infection in there. And there's the balloon opening the blocked passageway, and the balloon comes out. And now they're showing you here that we're actually irrigating some saline or potentially medication to cure the disease in there.
Is there a follow-up to this?
Generally, we'll see patients back the next week, and then maybe a couple months later.
Are they using nose spray in the interim?
Basically, just saline.
Just saline
and
spray.
Occasionally a steroid spray to help with some of the congestion.
Generally, do you recommend saline spray regularly?
In general, everybody should be using saline spray.
Isn't that funny?
On a daily basis.
We should be washing our noses.
Pretty much.
Flushing it out.
Think about what we're breathing in all the time. Cigarette smoke,
day?
particles. It should be like brushing your teeth.
At night?
Morning if you prefer, but at least once a day using a good saline, nasal saline spray is very healthy.
And there's no concern that by using the spray, things will build up in your nose? I know some medications can cause that.
No, the saline irrigation is a very, it's washing things out, if anything. You're taking out things that have built up.
Okay.
Yeah.
And what are the signs you have a sinus infection versus just a cold for the moment?
Well, almost every sinus infection starts as a cold, for the most part. So any cold that goes beyond 5, 6, 7 days, think sinus infection. Severe pain, headache. You can't. The interesting thing is you can't rely on the color of what's coming out of your nose.
Right, I've heard that the color is an indicator.
A lot of times it can be misleading. So
well, go ahead and tell them what color.
I don't want to gross out your audience, but
that's all right.
Green or yellow doesn't always mean a bacterial infection.
Okay, it doesn't always mean an infection, but if it is green, very green,
it could
you
be
might want to get to a
suggestive.
doctor.
Right, especially if it's gone beyond that 5 to 7 day point.
I don't want to leave them on that note, so tell me one more thing. How long after the balloon sinuplasty, how long do the results tend to last?
It's considered a permanent procedure. So in 85–90% of patients, we see successful results.
Okay.
And when I mean success, they don't need any more procedures and they're cured.
And they're breathing better.
And we're starting to do this in children as well. Obviously not in the office,
Right,
but
do that in
as
the hospital.
as an adjunct to what we're doing when they need something done for their sinuses.
Oh, keep me posted on that. I'd love to
Yeah.
do a case study with a child. Thank you so much,
You're welcome.
Dr. Weiss.
Thank you.
We have a break here, but we are so glad you joined us today. And make sure to check out my Facebook page, facebook.com/NEF12. In the meantime, have a healthy weekend.